So a vaccine works by creating an immune response. And there are two ways how you can create this immune response. One is by using a weakened microorganism, such as a weakened virus, that cannot really cause the disease, but can trigger the immune response, trigger your immune system to recognize it. The other common approach for vaccines is to use parts of a microorganism, such as proteins or sugars that the microorganisms have on their surface. What happens is that your immune system recognizes these parts as foreign, as sort of as enemies. And what it does, and that is intended, it causes an immune reaction. This immune reaction is what you usually would experience when you encounter the microorganism in nature. In that case, you actually go along with the disease, which you do not do when you get vaccinated. So the benefit is that your immune system now knows how the enemy looks and it can remember it. So next time you encounter that foreign microorganism, your immune system is very efficient in dealing with it. And this can last for quite some time. The benefits of vaccinations, and that's why they work, is they actually do not let you have the disease, or if you get the disease, just a very mild variant of the disease. Most vaccines actually prevent you from getting disabling consequences of an infection or even dying from it. And as we talk about COVID-19 now, what we also can hope to accomplish with the vaccine is creating enough immunity in the population that a pandemic can be contained. The risks of vaccine are very small in general. There's a very rare possibility that you have an unpredictable reaction to it. And just to give you a number, to give you an idea how frequent that is, I think it is more likely to get struck by lightning and win the lottery the same day than getting this kind of reaction. More common are allergic reactions. They are very rare nevertheless, and most of them are very mild. And if it's truly an allergic reaction, then of course it has to be addressed. What you observe most of the time is a mild immune reaction. And if you remember what I said just a minute ago, this is actually what we intend to happen. Your immune system needs to recognize that microorganism or parts of it as foreign and has to mount an immune response. But this is sort of a controlled response that we trigger in order to achieve immunity and protection from that microorganism.